Good afternoon, everyone. This is Jennifer Sinibaldi, ASTHO. Thank you for joining us today for our webinar, Radiation Preparedness, Community Reception Centers, and the Medical Reserve Corp. Before I turn it over to our first presenter, I just want to who they are and provide a little bit of information about who they are. So first we have Sherwin Levinson, who is the Executive Director for the MRC in Georgia, Gwinnett, Newton, and Rockdale counties. Sherwin Levinson studied physics at MIT and the University of Chicago before achieving an MBA in math methods and computers, also at the University of Chicago. While continuing his career as a computer and internet consultant, Sherwin has been Executive Director of a 501c3 nonprofit volunteer Medical Reserve Corp unit for over 7 years. During this time, Mr. Levinson and his MRC unit, MRC GEM, work closely with CDC personnel in developing the CDC's program for training radiation response volunteers. Our second presenter is Coral O'Brien, and she is the Office of Emergency Preparedness and Response at the Colorado Department of Public Health and Environment. She has been employed for the Colorado Department of Public Health and Environment for 25 years. She has been the MRC State Coordinator since December 2006 and the ESAR VIP Coordinator for the last 3 years. And lastly, we have John Williamson, who is the Administrator of the Bureau of Radiation Control's Environmental Radiation Programs. As such, he oversees statewide programs for radiological emergency response and training, the Environmental Radiation Laboratory, environmental monitoring and surveillance around the phosphate mining industry and the nuclear power plants, and the inspection of radioactive low-level waste shipments. John has been with the Bureau since 1992. He has been the administrator since 2006. Previously, he supervised the power plant surveillance program, and he started with the Bureau as a chemist supervisor in the environment class. Folks, I'm going to put everybody on mute, so if you do have something to say, just do *7, and you'll be able to speak.
The conference has been muted.
I just want to make sure all folks can hear me. So if somebody can just let me know, press *7.
We can hear you.
Excellent, thank you. I just didn't want to interrupt anybody's presentation. So prior to employment with the Bureau, he worked as a radiochemist for 3 years for the South Carolina Bureau of Radiological Health. And John is a Florida native and a graduate of the University of Tampa and the University of South Carolina. So let me just go ahead and next slide. So we'll have Sherwin Levinson first, Coral O'Brien second, and John Williamson third. So Sherwin, I'll turn that over to you. Sherwin, just press *7 so you can unmute your line.
Okay, hopefully that's better, right?
Yes, I can hear. I wanted to make sure that you weren't interrupted by somebody putting us on mute or on hold.
I appreciate that.
No problem.
Well, welcome everybody. I see that we broke the 100 participant mark just a few minutes ago, so we've got a nice size audience, even if they are all so quiet. And I'm here, I believe, because our MRC units were kind of the guinea pigs for the entire Radiation Response Volunteer Corps program. I'm assuming in the interest of time that you all know about the basic mission of the MRC program. You know why you might need to perform population monitoring and screen for radiation exposure and radioactive contamination. And you know the basic concept of CDC's Community Reception Center module. I've also hopefully left plenty of time for Q&A because I'm kind of lazy. I don't like to talk a lot, so I would just as soon you all help fill the time by asking questions. But if you have any questions about this, I'm also very happy to talk to you later, respond to emails, whatever, and my contact information will be sent out along with the webinar access info. So the first question I was asked to address was, how did our unit get into this? And the answer is, it's all his fault. Dr. Arman Ansari is one of our unit's members. He's a health physicist with the Radiation Studies branch at CDC. He's an expert in radiation safety, and his work involves response to radiation emergencies. Arman realized that response to a radiation emergency would require a large number of trained personnel, and that there weren't enough trained personnel around to meet the need. So he theorized that MRC would be a perfect vehicle for making trained volunteers available to fill this gap. Arman experimented on us. He held several training sessions about radiation, kind of gauged how trainable our average volunteers were, found out that, lo and behold, they were trainable, and taught us how to use survey meters, what the basic concepts of a community reception center were, what we would need to do there, went over paperwork, you name it, the whole thing. This resulted in a large-scale exercise in the summer of 2009, and they hired extras to be our affected population. Excuse me. They had a professional film crew to record it all for CDC's training materials, and it was quite an experience for us. The theory is that preparing to respond to a radiological emergency can attract radiation professionals to join an MRC unit, and radiation response training and exercises can provide an additional way to keep all volunteers engaged. Furthermore, just the regular MRC activities might help keep the radiation volunteers engaged, because we hope that there won't be enough actual radiological emergencies to keep them busy. In fact, of course, we hope that there won't be any. Unfortunately, we're all involved in preparing for the worst, not the best, which is how it should be. And no matter how close or far you are from a nuclear power plant, from a place that uses radioactive materials, or from major transportation corridors, if something happens and there's even a rumor that there's a radiation release, you can pretty well bet that people will be running the other direction, and that other direction might be where you are. So these opportunities helped attract radiation professionals to join our units, most definitely. Not only would their participation be invaluable in a radiation response, but the Medical Reserve Corps allows them to serve in other health emergencies if they wish, and we had about 50-50 success with that. About half of the radiation professionals we attracted have remained active in our unit. None of them have opted out. It's just that the other half aren't interested in our normal training activities, but I feel certain that if they were called upon in an emergency, they would do their best to come and respond. Our members found this to be a very valuable experience, and as we had new members come in and as their experiences kind of faded a bit, they decided to do their own training and exercise. And that was about 2 years ago, and that also proved to be quite successful. Despite our early involvement, Georgia's Department of Public Health didn't apply for a grant from the Conference of Radiation Control Program Directors until last year. Those grants are funded by CDC, and they're made available to extend the concept of training and organizing radiation professionals to respond in a radiation emergency. But we did get a grant last year, and we used that grant money to educate MRC members and radiation professionals statewide about community reception centers and the need for trained personnel to perform screening. We had a great response, and our one full day training session was filled to capacity. So we now have additional official Radiation Response Volunteer Corps members, and our unit, MRC GEM, will be applying for a grant to do additional training throughout the state, which is what I already said. We're also planning on organizing a conference to bring together the people who are involved in radiation response who haven't previously been involved in the Radiation Response Volunteer Corps effort, and see how we can coordinate our plans and how we can or better organize all of our volunteers so that they would be available to all of the stakeholders in the event any one of them has to respond to an emergency involving radiation. So that pretty well covers what I've been asked to cover today. And I'm not sure if we want to take questions now or wait till the end of all three presentations.
Sure, we can take questions now, or we can wait till the end if folks prefer that. So I'll open it up for questions now.
And that is *7 to unmute.
It's *7 to unmute your lines if you have a question.
Hello, my name's Allie. I'm calling in from Public Health Seattle and King County in Washington State. We're working to develop a similar program and wondering if you have screening tools, sort of training materials and assessment forms that you used in your drill that you could share with people on this webinar.
Absolutely. Not only do I have them, I'm also working with Dr. Ansari right now in gathering together the materials that have been developed by all the programs and putting together kind of a compendium of the best to make available to those who want to do their own program. But the answer is yes, I would be happy to share. In fact, I'd be happy to share everything I've gathered together so far. It just hasn't been totally classified. Maybe you could even help me go through it and say, you know, hey, this looks like it would be really useful, or I find this confusing, something like that. Would you be willing to help with that?
Sure, I'll follow up by email.
Okay, that's wonderful. But yes, I can send you probably more than you want.
Steve Hood, Loudoun County, Virginia Health Department. How did you recruit your radiation professionals? Was it a general news advertisement, or did you go to a selected list, licensed professionals?
We publicized this with the local hospitals to try and get their radiation professionals, and also we emailed and mailed flyers to all of the local radiation societies that we could find. Our state radiation control program director contacted the companies involved in nuclear power plants. So, you know, we reached out to everybody that we could, every way that we could. Personal appeals certainly work better than advertisements. Does that answer your question?
Yes, it did. Thank you.
Okay, great. Anyone else?
Hi, this is Bill Pook from Region 5-6 Emergency Management in Fremont, Nebraska.
Hi.
I just want to give a plug for the MRC providing staff assistance at our reception and care facility for the Fort Calhoun Nuclear Power Station. We have a great relationship, and they are our primary cadre of personnel monitors. We find that the REP program, with all of its regulations and scheduled training according to the new reg document, provides them with a schedule and structure that they can organize around to keep the MRC players and participants engaged during times when there might not be other activities for them. So we have a great relationship. We love our MRC, and our program is a better program because of their volunteer participation.
So now we have an independent testimonial as well. Thank you. Did you participate in the Amber Waves exercise a few years ago?
My office did not, no.
Okay. I wasn't sure if that extended beyond Kansas or not. That was a large-scale radiation response exercise that I know the Kansas radiation response volunteers were involved in. Okay. Any other questions? Okay, well, should we move on?
Yeah, we can go ahead and do that. Just for those folks that we're still trying to, we need to get some extra lines. I know there's been some chat over our line here. We're getting extra lines added in, so I'm broadcasting that through the chat function. So, you're up. Go ahead, Coral. Press *7 to unmute your line. Coral? Coral, you can either press *7 or the mute function on your phone.
Can you hear me now?
Yes, I can hear you. Go ahead.
Oh, yay! All right, so you can change the slide, please. So Colorado in 2012 requested and received a grant from the Council of Radiation Control Program Directors. It was a one-year grant that we extended for a second year in the amount of $1,600 or $16,000. Sorry. We used the dollars to provide trainings, travel to the PERT conference to present, printing and distribution of mailings, travel to provide trainings, repair and calibration of meters, supplies for the stations at the reception centers. So we'll actually have two caches, one for Denver and one for Grand Junction, because we have the mountains in between us and sometimes we can't get over the mountains. So we actually developed two caches. Next slide. So our recruitment, we received a list of agencies.
I'm looking for Deborah. Is she available?
Not right now. Deborah's not available.
I'm an emergency manager with Region 5-6 out of Fremont, Nebraska.
Folks, I'm just going to mute everybody's line again. If you do have a question or comment to ask, please press *7. So I'm going to mute everybody right now. So Coral, you may have to press *7 again.
Okay.
The conference has been muted.
Can you hear me?
Yes, I can. Thank you.
Okay.
Go ahead.
Okay. So we received a list of the agencies that the radiation program.
The conference has been muted.
Coral, you may have to press *7.
Are you there?
Yes, go ahead.
Am I here?
You're here.
Okay. So we received that list of agencies from the radiation program that they monitor, and we sent recruitment letters and brochures out. Plus, we sent out letters to the hospital emergency response, preparedness and response folks, asking them to give them to their hospitals. There were about 350 of those letters that we sent out. We currently have 85 people in that have either attended or are in our ESAR VIP program. We have 37 people who are accepted volunteers, 27 that are pending, and 21 that have participated in a training that maybe have not registered at this time. We also asked the other states, specifically Kansas and Florida, to provide us the information as far as their trainings and plans that they had, and we've used a lot of that so that we weren't recreating the wheel. So next slide, please. We've done 4 of the, we call them Radiation Response Volunteer Corps volunteer trainings. We provided a modular emergency radiation response transportation training, which is MERT. We did 1 hands-on meter training, and we sent about 13 of our folks to the CTOS, Center for Radiation Nuclear Training in Nevada at the Nevada National Security Site. They came back and said it was just an awesome training, so that's really good, a great training for the folks to go to. So our new volunteers, our training consists of, can you change slides for me please? These are the things that we go over in our new volunteer training. The psychological first aid training, they get a certificate for attendance for that. We do, depending on the time frame, this can take an entire day with those trainings, but it also, we can cut it back if we need to. So if they don't really need the Radiation 101, then we can take that piece off and kind of work around that. Next slide. The radiation program grant that we got, the radiation program from here at CDPHE gave us 15 of the meters, and so we had them recalibrated, and there were cords that weren't right. The cables weren't the right cables, so we got those replaced. And they also gave us a bunch of other supplies, such as Tyvek suits, rope, poly sheets, a small generator, and other things that were very helpful to put into those caches that we developed. Next slide. So the Radiation Response Volunteer MRC actually became a unit on May 27th. Our unit coordinator is a retired health physicist from the CDPHE with 20 years of experience. It is a standalone MRC, and we ask that the folks that join that MRC also belong to their local MRC. What we feel is that if we have this statewide MRC, then we can get them trained in the way that we need them trained, and then adding them into those other MRCs keeps them involved more with what's going on in their areas. But if there isn't an MRC in their area, then we're able to collect or to have those folks join us without losing them. Our sponsoring organization for our MRC is the Central Rocky Mountain chapter of the Health Physics Society. So that's a great avenue to work closely with that organization, that society. So because we just started our MRC in May, we've got a lot of steps ahead of us to create a board, review plans, develop policies and procedures, continue recruiting volunteers, conducting and training exercises. So that's kind of where Colorado's at. We're fairly new. It's taken me a long time to try to find MRC members and volunteers that want to do this, but I think we're getting there with about 64 people that have actually signed up in our ESAR VIP program. That's it for me.
Coral, there are actually 2 questions on the chat. One is the CTOS Nevada training a free training?
It is kind of like the, what's the Alabama, the Aniston trainings. It is completely free. There are, I think, some requirements, but pretty much it's free, and they pay for everything to go to it.
Excellent. And then do they have RAD suits for all 85 members of the MRC?
RAD suits?
Mm-hmm.
What do we mean by RAD suits?
Sheila Martin, are you on the line? Just press *7 and maybe you can explain. I'll ask her to elaborate a little bit.
Well, and just so you know, we do have like Tyvek suits and those kind of things. We don't have like they're not going to be they're not going to be first responders, so to speak. So we probably don't have what you're thinking, Sheila, just so you know.
But are they safe for all the members to wear then? It will keep them free from radiation?
Well, like I said, we're hoping that we're not going to be in contact with them, and that's probably more of a unit, my unit coordinator's a question for him, and I can ask him that if you'd like me to. He's not here, but I could get that information and send it to you, Sheila.
That'd be great, Coral. And still, we have a big San Onofre, which is down in San Luis Obispo and near Ventura counties, and we have a large group of people there. They might be interested. I know they did a basic training not long ago, and they haven't gotten any grants or anything, but it might be something they could look into if we can make them feel comfortable.
Right. Great.
If I can interject for a minute, if that's okay.
Sure.
Our concept, at least, is that while we'll exercise standard precautions, the point is to screen people who may have been contaminated but are highly unlikely to have anything highly radioactive on them. So they'll be perfectly safe using N95, wearing gloves, eye protection, because it's going to be most likely nothing more than the equivalent of dust, something that can be washed off. If we're talking about a particular kind of improvised nuclear device, it is possible that people would have highly radioactive shrapnel embedded in them, but that's not something that our volunteers would be dealing with.
And I agree with you, and that's kind of where we are at with this whole with the whole process.
Well, that makes a lot of sense. Thank you very much.
Are there any other questions for Coral? Okay, well, hearing none, thank you, Coral, for your presentation. And we'll move on to John Williamson. You're up. Press *7 to unmute your line.
Can you hear me?
I can hear you.
Okay. Good afternoon. I'm going to start a little differently than the other two because ours was done a little bit differently in that we don't organize the MRCs. All Florida's program, from my basis, consists of is designing the training and presenting the training. Can you flip the slide, please? We received a 2010 CRCPD grant. It was one of the initial grants. It was $25,000. It was designed for us to start the whole process of using MRCs, or a volunteer corps, to do population monitoring. Since then, we have used CDC preparedness grants to continue to provide the training to our local MRCs. We have 2 professional trainers on the staff of the Bureau. We use them to develop the training material that we use. We have a 4-hour didactic that we do in the morning session, and that essentially is designed to give all the attendees an awareness level training that meets OSHA requirements for hazard awareness. And then we do a 3-hour training in the afternoon where we actually get out the instruments and we let them go through a series of stations using the instruments to get an indication of how they perform, what the difference is between contamination and exposure, and how to tell the difference between alpha, beta, and gamma radiation, and those type of things. Talking about the instruments real quickly, in 2006 we attended a population monitoring drill given by a fire department in Florida, and we were so disturbed by their means of doing the population monitoring that year we wrote a grant to buy 200 instrument kits and 20 portal monitors for the state of Florida and start looking at developing a volunteer cadre for doing population monitoring. So we received those equipment in 2008. It consists of 200 friskers, 200 Canberra ultraradiacs for doing measuring of dose, and then we also got 200 electronic dosimeters, and we bought 20 portal monitors. And these are distributed at 7 or 8 different locations around the state so that we have a set of this equipment that can be deployed quickly anywhere in the state where it's needed. We use only the professional staff from the Bureau to do the training. We have about 8 different instructors. Most of the instructors are either certified by the Florida Fire College or FEMA certified, or people who've worked for the Bureau a number of years. I think the minimum anyone who's worked for us is about 15 years that does the training for us. Our target audience is MRC members, but even more so, Florida has 25,000 licensed rad techs, nuclear med techs, and we do burst emails to these. When they register, there's a little checkbox that they can put if they're interested in volunteering for emergency. And if they've indicated that, it goes into a database, and we can get their names, and we can send out email blasts to try and solicit their attendance at the trainings. To date, we have about 1,285 personnel that we've trained. Next slide, please. Some of the critical success points I think we have is that we try and be green. We don't print copies of our presentations. Instead, we put it on a USB stick, and we give every single attendee a copy of the USB stick. It has all of the reference materials, has our presentation, has a number of links to various informational resources. We provide CE credits when feasible. We have permission to give 7 CEUs to nurses and to rad techs. And I can tell you that that is one of the main drivers that get people to actually show up for the course. In the course, we provide training for both external and internal contamination. We have an online sign-up. All somebody has to do is go to the URL that we have, and they can sign up right there. They don't have to make any phone calls, and they just show up the day of the course. We believe that hands-on exercises with the instruments is critical to the success. You just can't get enough time on an instrument. Even rad techs and nuclear med techs don't tend to use radiation detection instruments that frequently, and when they do, they're typically not for the same usage that they're going to be doing at a CRC. So we have found that giving the students the instruments, letting them use them in the afternoon exercises really helps. We get I'd say our ratings average about a 4.8 out of 5 for our course, and the majority of the comments are that they really love the instrument portions of it. We have our local MRC coordinators talk about MRC membership. This course is open to anyone who wants to sign up for it. They don't have to be a member of the MRC. At the very beginning of the course, we have the MRC coordinator stand up, tell about membership in the local MRC, what the benefits are, what expectations we would have, what expectations we would have of the students if they join the MRC, and then try and move on from there. Next slide, please. Some of the takeaways that we get. We do get a lot of nurses who attend the course. We realize it's very unlikely to get them in a real event, yet we still believe it's very important for them to attend because there are many healthcare professionals who have indicated that in the event of a radiation emergency, they would be too scared to show up for work. After we give them this course, we have uniformly good comments about they have a much better understanding of the risk of radiation, and it makes them much more likely to feel comfortable working with patients contaminated with radioactive material. I'd say less than 25% of our attendees are actually registered volunteers. We need to do additional outreach after the course to get the attendees to sign up and become a registered volunteer. We have a 40% or greater attrition rate between the number of people who sign up and the number of people who show up. As we don't charge a fee for the course, I'm not sure we're ever going to see an improvement of that, but it's just something to note. As I indicated earlier, the reviews are extremely good, but obviously opportunities for improvement exist. And no matter how much we give to the students in the afternoon, many of them actually say, I need more time on the instruments. And as a result of that, when we look at our just-in-time training, if in the event of a real emergency, we intend on heavily concentrating on the use of the instruments rather than the basic safety precautions they have to do. And then the students almost uniformly want the ability to participate in a real drill. We've had 2 drills in Florida, one in July 2011. The other one was last year. We're doing another one this year in conjunction with an off-year nuclear power plant exercise. The big deal on that is if we can pay for the travel, we have a great large number of the MRC volunteers who are actually willing to travel to the drill and participate in it. Next slide, please. And that was it. Take any questions.
Hi, John. There's actually 2 questions on the chat. One is, can you please say more about how you were able to get CDC Preparedness grant to continue training and developing the RRVC program? And what suggestions do you have for the other RRVC programs to try to secure the same funding from CDC Preparedness grants?
Well, that's an interesting question. Partially because our Bureau of Radiation Control is part of the Health Department, and we are actually in the same division as the people who write the CDC Preparedness grants, we simply made a request that in order to do this training, we would like to have funds to do it, and that's the mechanism by which we went. Because grant writing and determination is different in every single state, I can't say on a definitive basis how to do it, except that find out who is responsible for submitting the preparedness grants for the state and local health departments and talk to them about engaging and trying to fund MRC training for this.
And then the other question that came through is, do the grants allow for costs of calibrating, recalibrating instruments, and where are the instruments recalibrated and how often?
Once again, I'm going to cheat on that one. If you wrote the grant to allow that, it could. However, our calibration laboratory is right down the hall from my office, so we calibrate our own instruments.
Okay, and I guess we'll open it up for any other questions. Press *7 to unmute your line. Folks, if you do have a question, you can unmute your line by pressing *7. And in the meantime, we do have a question. It says, are you located in Florida's state capital?
No. I'm in Orlando.
Great. Questions or comments, just press *7 to unmute your line.
Hi, this is Deborah. Wondering if I'm reaching through?
Yes, you are. Go ahead.
Hi, I'm in Virginia, and my district has a Surrey nuclear power plant. And we have a lot of military installations next to us and in close proximity. I'm wondering, did any of you do recruiting through the military?
Florida has not, to my knowledge. One of the reasons we do have access to the CSTs, and one of the reasons we haven't done the recruiting is that in the event of a real emergency, we believe they're going to be designated to have to respond anyhow. They're not going to likely have the freedom to go act as a volunteer.
And that makes a lot of sense. Did you give any thought to approaching retired military personnel?
Actually, that we have had a number of retired military personnel who have come to our course. The problem is reaching anyone, and what we use for that is that the local MRCs do a variety of different types of recruiting. We've also done recruiting through the CERTs, the Civilian Emergency Response Teams. We've had some of them show up as well, and they tend to have a lot of retired military as well.
Okay, great. Thank you.
any other questions? In the meantime, we do have, I guess going back to the question regarding your location in Florida State Capitol, somebody had asked, why is that? Is that closer to a nuclear facility?
You mean why are we where we are?
Yes.
The nuclear power plants in the state of Florida are located in Miami, in the south part of the state, and on St. Lucie, which is on the southeastern area. The laboratory was located in Orlando to be centrally located rather than in the state capitol.
Thank you. Any other additional comments or questions? I thought we have another 20 minutes if folks had things that they wanted to share, or if you thought of additional questions or comments you'd like to share with our presenters today. Again, if you'd like to make a comment or you have a question, press 7.
Hi, this is Stacy Sarah. I was just wondering what associations folks might connect with, or organizations that radiation professionals tend to be members of.
The National Health Physics Society and the state chapters. The Society of Nuclear Medtechs.
Hi.
And then the other one is the...
Are you thinking of CRCPD, which is a Conference of Radiation Control Program Directors?
Well, yeah, except that's all going to be your state programs. Those are going to be pretty obvious. It's the other one for medical. I'm trying to think of what their name is.
There's also additional information. ASTHO, NACHO, and the CRCPD actually have created the National Alliance for Radiation Readiness, and there's a lot of other organizations involved. You can go to www.radiationready, that's all one word, .org, and you'll find a lot of information on there about different tools and resources that are available. So we can also have that shared with any of the materials from today's webinar.
Oh, I'm sorry, AAPM, the American Association of Physicists in Medicine. That's the other big one. They've been worked with CRCPD and a number of other organizations as well.
Do our presenters have any additional comments they'd like to address with our participants today?
I don't. It was very nice to have the time to present what Colorado's doing. Thank you.
You're most welcome.
Florida says the same. Thank you very much.
Great. Well, thank you so much.
Bye.
And same for me.
You're welcome. Well, thank you to all of our presenters, Sherwin, Coral, and John. Thank you for joining us today. This webinar will be available within the next couple weeks, and we'll share that with those that are registered and also participated on today's webinar. If you have any additional questions, please let us know. And thank you so much for joining us, and I hope you have a wonderful rest of the day.
Thank you. You too.
Thank you. Please stand by.